Really, it's not a new change for most school psychologists. Many school psychologists have already been working in states and districts that are engaged in RTI procedures, and they've been very involved with the implementation and planning for their districts and in the rollout of the RTI plans. Of course, there's still many districts and states that are in very early stages, so school psychologists working there are also having to get oriented to this new change in educational philosophy and programming. My organization, the National Association of School Psychologists in the field, look at RTI as a great opportunity, a great venue for school psychologists to really contribute in a way that greatly enhances their roles and greatly enhances the services that are provided to students. So we look at it as a chance to step into that consultative and problem-solving role. RTI allows school psychologists to use the full range of skills. So in addition to performing the traditional assessment role, school psychologists play in a RTI framework, they can play a very important role in terms of consultation, in terms of program planning and program evaluation, also in terms of understanding research and helping to summarize RTI research that might be helpful to the school district. These types of activities really greatly enhance the school psychologist's role. And in addition to being seen as an assessment expert, now school psychologists within an RTI framework can also be looked to for as instructional and, very importantly, mental health specialists. At Tier 1, we're really talking about having quality core instruction for all students. So in this, at this particular juncture, school psychologists might volunteer to be on a district or state committee. That might be an RTI planning and implementation committee. Oftentimes there are related committees that they could be part of that could help, and these might be something like a disproportionality committee, a committee that addresses positive behavioral interventions and supports, curriculum committees. In addition, the consultative role within all of RTI is very important for school psychologists. So on Tier 1, it might be looking at what instructional plans there are for a given school and helping the teachers and administrators make plans accordingly, to look at what types of student progress monitoring systems they're going to use, and helping make decisions that way. When we talk about Tier 2 and Tier 3 interventions, there's a lot of planning and decision making that has to go on at these levels. So both at Tier 2, it might be helping to pick research-based interventions for small groups of students who need these types of interventions, helping with the school team, the teachers, and the RTI team monitor their progress. Certainly at Tier 3, with the very intensive either one-on-one or very small group types of interventions, school psychologists again can be helpful in some of the individualized problem solving that must be carried on at that level and must be carried on with individual students. And also very critical here, if a student does not make enough progress or does not respond to these interventions, it may be indicated that they have a learning disability, and there may be a need at that point to consider a special education evaluation. So they can be very helpful with the team in terms of making this decision, looking at the data and deciding whether this might be an appropriate step for this student. A couple other things just across the different tiers for school psychologists. One of the services they can offer is having close collaboration, homeschool collaboration. So very importantly, having the parents involved and communicating and helping them understand what this means in terms of the shift in the field and how RTI really changes the landscape, both in terms of the types of services students get and how school teams are going to be looking at student progress.